So this is going to be the 90-90 sit where we're working on trying to open up that right side and find a little bit more activation through that left oblique, right? So once again, like we were talking about last time, trying to strengthen up through the left oblique and find that openness through the right. So you're going to find the 90-90 sit, right? So lining up the knee and the hip, knee and the ankle, same thing here in the front. You're going to come out to the side. Here, we don't want to sink in the shoulder, we want to actually hold ourselves up. And then you're going to slowly drop that right oblique down towards the floor, leaning into that left side, right? So kind of side bending into the left, biasing that space there. Now, there's going to be a tendency to kind of want to, like, as you lean down into that, to kind of rotate to the left a little bit, but I actually want you to rotate right and pull that rib cage down just a little bit so you're getting into that nice compression on that left side. Okay, there's also going to be a tendency to want to lean back, but I actually want you to lean forward into that front leg just a little bit so there's not as much weight kind of in the back of the hip on this side. You're actually going to load here. Okay, so from here, you're going to drop in, compress, feel that compression through that left side. Good, and then we're going to get the three-step process here. So we're going to find the reach. So it's not a protraction. We're not pushing and rotating to get it here. We're setting that shoulder in line. So you want to kind of pull it back and hug it into your side a little bit. Feel that work right in here in the ribs underneath the armpit. Okay, so you're kind of adducting or pulling your arm into your body here. And right away you should feel those muscles turn on. Now you're going to take a big deep breath in. And on the exhale, locking out that elbow, pulling in just a little bit, you're going to reach towards the opposite end of the room. Now, it's not a very big movement. It's more about the activation. You're thinking about transferring energy from your shoulder through your arm down to your fingers and out across the room and feeling that squeeze. So breathing here. So big breath in, keeping the squeeze. And out. Trying to keep that squeeze. Big breath in. And out. Good. So you should be feeling a lot of work kind of through this rib cage space here and maybe down into the oblique a little bit. Now, step two is we're going to drive that in just a little bit more, really trying to connect to this left side. So you're going to take a big deep breath in, set that shoulder, maybe sink into that right rib cage away or opening that right rib cage just a little bit more. Take a breath. Hug in, reach, and this time you're going to try to lift up and squeeze backwards. So you're trying to find that glute med, kind of that posterior glute just a little bit here. So you're getting abduction, lifting the leg up and moving back. It's not going to go very far, but you're going to find that work. Okay, so big breath. Exhale, squeeze, and then up and back. So I'm going to come down here just a little bit so I can give myself a little bit of space here. And basically this is what it looks like if I could clear the distance, right? So I'm getting that leg up in the air and I'm reaching for the opposite end of the room and I'm squeezing backwards. So I can feel that posterior chain working and then I relax it, okay? But because I'm cut off right here, it's hard for me to actually get that distance. So I can't really lift my leg up, but the work is there. Okay, so we're trying to tie this, this, and this all together, right? So let's just get a couple there. Big breath in, hug in, reach, and squeeze up and back. And relax. Trying to drop into that rib cage just a little bit more. Big breath in, feeling a lot of work in this oblique. Squeeze in, reach, and lift up and back. And relax. Good. So do that about 3 to 4 more times and just feel that work on that left side, trying to connect to all those tissues.